everyone, in this video I wanted to share mnemonics for the various heart valves. So I've drawn the heart right here, and then we have the SVC coming on here, the IVC coming into the right atrium. From the right atrium, the blood will flow to the right ventricle into the pulmonary arteries, and then to the lungs. After being oxygenated from the pulmonary arteries, the blood will come back through the pulmonary veins drawn here into the left atrium, and then go into the left ventricle where it's ejected from the aorta to the body. So this is basically the heart that I have drawn. Now let's start with the various valves that we see in the heart. So between the right atrium and the right ventricle, you have the tricuspid valve. Between the right ventricle and the pulmonary artery, you have the pulmonic valve, and that's super easy to remember because it goes to the pulmonary system. And then blood comes back to the left atrium, and then between the left atrium and the left ventricle, you have the mitral valve, and then from the left ventricle into the aorta, you have the aortic valve. So the way to remember the four major valves and their cusp is super easy. All of these four major valves have 3 leaflets. So and it's easy to remember, right? So the tricuspid has literally a tri in it, so it's 3 leaflet. And then the pulmonic also is tri-leaflet valve, and so is the aortic. So the only one which is bi-leaflet or has 2 leaflets is the mitral valve. And the way you remember this is like, you can literally imagine like the M being like 2 leaflets, and that's how you remember that the mitral valve is a bicuspid valve. And another mnemonic that I would like to share, well, these are not really valves but like literally like flaps. And then the IVC also has a valve, and it's known as the Eustachian valve. And the coronary sinus, which is like the artery that drains the venous system of the heart, has a valve, and it's called the Eustachian valve. And the way I remember this is CT. So C for coronary sinus, T for Eustachian valve, and then IE. So I for inferior vena cava, and E for Eustachian valve. That's all. I hope that this video was helpful. There is a video that I made previously on how to draw the heart, and drawing the heart with me, it's pretty easy as well. So check that video out and stay awesome.